My name is Ian Jackson. I'm Director of Bromley by Bow Health Partnership, but I have been, over the last year, been supporting the care group in terms of the cycle of demand work in the PM Access Fund programme.
My name is Emma Cassells. I'm a Programme Manager at the Bromley by Bow Health Partnership. I've been managing the cycle of demand work alongside some colleagues, Mike Fitchett and Ian Jackson. We're here today to share some of our findings and some of our suggestions, and we're really hoping that everyone here is able to take something away from the day and try some new stuff out in their own practices.
Firstly, we want to showcase the work that we've been doing for the last few months, share that with as many practices as we can, and reflect back to them the great work that they're already doing, and also offer them some resources about how to further embed that work in their ongoing day job.
My name is Nick Goldup. I'm the Partnership Director for WizKids. We're really pleased to be here today to represent the charity. We're a national charity providing wheelchairs and added value services such as camps and clubs, wheelchair skills training to children and young people across the nation, really, including in Tower Hamlets. We run the wheelchair service here, and we're really pleased to be working alongside the local healthcare professionals here on the Prime Minister's Challenge Fund work, where we'll be carrying out some feedback for young people and providing out-of-hours pilots into the GP hubs.
I'm here to represent the Hurley Group and talk about the eConsult product. Just here to kind of flourish it and get many more practices to start using it so that they can see the benefits of it and improve greater efficiency, greater care, and get the best out of it, really, so that patients have another channel of communication to get through to their GP surgery using today's technology.
Yeah, my name is Raj. I'm an independent prescribing pharmacist.
Hi, my name is Anwar. I'm also an independent prescribing pharmacist.
Hi there, it's Jonathan Poon, and I'm also an independent pharmacist.
We have been selected for the Prime Minister's Challenge Fund, and we shall be doing prescribing from our own pharmacy premises. And the idea is to reduce workload from walk-in centres and A&E. Sometimes there are appointments that can be dealt with in a pharmacy environment, basic conditions which doesn't require referral to a hospital or an A&E. And the idea and objective is for us to kind of reduce that workload by dealing it within the pharmacy. So we shall be doing that within our local area, all three of us in three different locations within Tower Hamlets.
The Prime Minister's Challenge Fund project has been really important for primary care in Tower Hamlets. It's enabled resources to be brought into Tower Hamlets to trial, access and 8 to 8 working across the borough, and allow us to plan to see what services are best delivered for our population and what they really need from primary care in hours that aren't traditionally called working hours. We'll have learnt lessons and we'll have had a broad foundation for the future to enable us to deliver the sort of quality care that we all expect as population health care in Tower Hamlets.
I've come here today for the Prime Minister's Challenge Fund meeting. To be honest, it's not something I know that much about, so I'm interested to know what's it about, what's going to happen with it in the local area, and how we can get involved with the process in the local surgery to help bring about the best possible change for the local patients.
I'm here today because we did some work on this cycle of demand, and we're here to share what we found, what we discovered, as well as sort of like find out from others what they did on the other strands of Prime Minister's Challenge Fund.
I'm Rosemary Williams. I'm a bit of an interloper today. I'm the Programme Director from the PMCF programme in South Worcestershire. So I've met people locally before, and I'm here just to find out a bit about what you're doing and to share with you lessons from South Worcestershire.
The reason I'm here today is because, one, I'm a support facilitator to roll out the various strands of the PM Challenge Fund through networks and GP practices. I'm here today to offer support, to help other colleagues understand where we are with it, what our goals and our objectives are with the PM Challenge Fund. And I suppose my fundamental outcome today is to be able to able to see the progress we've made in embedding the PM Challenge Fund work streams into the network operations and the GP practice operations, and to be able to see the evidence that we can present today on actually what a difference it's made for patient care and access into GP care through the primary care hubs.
Hi, I'm Dave Alquist. I'm from Town Hamlets Community Transport. I've just come along on a bit of a fact-finding mission, really, to find out what the Prime Minister's Challenge has been delivering over the last few months and years, and really to see if we can get involved as community transport in supporting some of the health stuff and getting more people into practices and improving healthcare. That's what I'm here for.
I'm here today because we've had an experience with the Prime Minister's Challenge Fund and locally, and this is really about their work towards social prescribing. Now, public health is involved in the community side of social prescribing and all those community assets and wellbeing organisations. So what would be really great today is if we could do some joint work 3 months down the line with some outcomes, really good outcomes by 6 months, in the devising of the model of social prescribing in Tower Hamlets.
I'm here from the Bromley by Bow Health Partnership. It's actually just the third day of a new job. I'm working as a Well community organiser for the Well programme. So I'm trying to connect and engage with people in the community so that we can work together and co-create a new model of care, which is what the Well programme is all about. So I'm just here to connect with other organisations and find out what works and what doesn't when you're working within a community to improve health.
I had a really good time today. We had a very good discussion of how to go forward with the Prime Minister's Challenge Fund and to look at the opportunities as well as the threats within that. And there were lots of very interesting discussions. Some of the key elements that came out today was one about communication and how we can do the work better by having a telephone system that works for the entire borough. And also one of the things that came out of our group especially is that we want to work that public services, the general practice should be talking to public services which sit in the local authority. So we want to have a telephone system where a patient can phone in and then they are signposted to whatever they want to go to, whether they want to go to a hub appointment or see their GP, or they want to be able to manage their illness themselves. So it's a minor ailment to signpost them to self-management website or get an appointment with a pharmacist. We are already working in a federated system. How can we work in closer integration, not just as GPs, but also with district nurses, with healthcare visitors, with community pharmacies, with public health in the local authority, so that that we can survive as a much more efficient NHS, free to all at the point of first contact.
Today I came here to learn a bit more about the Prime Minister's Challenge Fund and the bits of work that our project's involved, and I've learned quite a lot more than I actually expected. I actually like parts of the evaluation, but also interestingly the other bits of work going on in other parts of the country, and it's good to see that here in Tower Hamlets we're not alone in some of the struggles that we're coming across, but it is a pilot, so I'm quite happy with today.
We've had a really interesting afternoon. We've had a great turnout from practices in Tower Hamlets. I'd like to thank my colleagues from the One Care Consortium and from South Worcestershire GP Services for coming and sharing their progress to date, and we've got some really good feedback from people about what happens to the Prime Minister's Challenge Fund next in Tower Hamlets. I'd like to say a big thank you to everybody who's come and taken part.